Prostate cancer can be treated precisely and in a non-invasive manner with Austin CyberKnife. Dr. Doug Rivera is a radiation oncologist and medical director of Austin CyberKnife and Austin Cancer Center. He joins us with more. And doctor, I guess first of all, what are some of the current statistics as far as prostate cancer?
Yes, thanks. So thanks for having me. One of the things we want to talk about today is something really important in men's health, and then talk about a novel way we treat that, both in the country, but here particularly in Austin. So prostate cancer is a big problem when it comes to cancer. Cancer, as you know, is a large kind of health problem. Prostate cancer is the #1 cancer in males, and of that, second most common cause of cancer deaths in the U.S. Amongst males, lung cancer being the #1.
Who is more at risk? Does age, race, ethnicity, does that play a role in risk factors?
Yeah, I'd like to say that we know very clearly, what drives this. That's one of the questions I get every day as a physician. How do I get this? Why did this happen to me? There are a lot of very loose associations that we see. Diet, obesity, smoking, vasectomies. I've seen this in the studies. Various different things. None of them really been proven to be. Some studies say yes, others say no. Some of the things that we do know genetics play some portion of that. Obviously, people who have a family history, their brother or father, have a higher risk, and we generally recommend screening earlier for them. But the the more common patient that I see actually has no family history of prostate cancer at all. And that's actually the most common thing. There are some differences in race and ethnicity. Asian males typically get it less than, say, African American males in our country. African American males tend to have a more aggressive type of cancer as well.
Okay.
But the #1 kind of predictor of prostate cancer is really age, believe it or not. And when you look at it, in all cancers, they really start at about the age of 50, and the incidence goes up with age. And then for prostate in particular, it tends to be a little bit older. About almost two-thirds occur roughly at the age of 65 or older.
So how does CyberKnife treatment differ from a traditional radiation?
So what makes CyberKnife so novel, and it's really the only one here we have in Austin, at the University Medical Center Brackenridge is the only one in kind of the Central Texas community, but it really specializes in doing 5 treatments or less, and that's what makes it very unique. It's a very precise and accurate machine that does that. And what allows us to do, the traditional conventional radiation aspects are 40 to 45 treatments typically. And a lot of data now are showing that if we can do less treatments, more at least less treatment times, and a lot less time for the patient. And so a lot of these trials have come out now, have shown that you can do it a lot less. And then even CyberKnife really pushes that to the most extreme, which 5 treatments could be the same as doing it to 40, 45 treatments.
Thanks so much for coming today to tell us about it. We appreciate it. Thank you. And Austin CyberKnife is located on I-35 at the University Medical Center, Brackenridge. Call them at 512-324-8060 or go to austincyberknife.com.